Okay, how's everybody doing today? Welcome to day one of the Low Back Health Challenge. If you know me or not, either way, my name is Dr. Eric, physio here at Modus RX Physical Therapy, and we're excited about the next 3 days. We're going to bring you 3 different tips and basically 3 different maybe exercises, maybe tips, maybe simple things you can do on your own to all naturally, no medications, no surgeries, all naturally ease your back pain that you may or may not be having. This is really, really good for you, regardless if you don't have pain or if you have pain, because these are things that they're staples in a lot of our programs for everybody. So, to give you a little background, low back pain and individuals who are struggling with low back troubles is kind of our one of our primary niches here in specialties, and it comes from the place of we're sick and tired of basically the number of people that are having back issues that are not getting answers in the more traditional model. And obviously the most recent epidemic of opioid and painkillers and what it's really doing to our community and our country is devastating. And I feel like personally we're the perfect fit to take this head on in our role. So that's why we're excited to celebrate the kickoff of our first series with the Low Back Health Challenge. The first series that we're going to do this year is on low back. Okay, so that gives you kind of the premise there. Now, as people may or may not be jumping on here, I want to ask you, if you do hop on and you're catching this live, make sure you type into the comments that you're watching live. We'd love to see who's on with us and maybe get a little interaction going. And if you're watching replay, then certainly make sure you hit Team Replay in the comments, and we'll see if you have any questions. We can certainly answer you well after the fact as well. All the individuals who desired to be tagged to make sure that they get this video alert, I will put that in the comments as well when we're done here. So, I'm not going to give any boring statistics on low back pain. I'm not going to give you any little mini kind of abdominal tuck drills or anything like that today. We're going to get right to the nuts and bolts of what we've started prescribing every single individual that we work with that has some form or fashion of low back trouble and other issues for sure. But before we do that, I want to ask you to stick around to the end. If you're going to join the challenge and get the free giveaways at the end, you do get something just for participating. But if you participate in all 3 days, you are going to get the Granddaddy Prize, which is going to help you in some form or fashion. Trust me. So we will announce that on Friday, all right, the 11th. But stick around to the end of the video. I'll give you instructions, and if you follow the instructions, that enters you as a participant in the challenge, and at the bare minimum, you will get our participation trophy, so to speak, okay? All right, so low back pain, all right? So I'm just gonna give you a brief summary of why we talk about what we're gonna talk about today. When you have pain in any area of the body, pain automatically causes what we call inhibition, okay? So the muscles will automatically stop working or work less efficiently because of pain. It's a short-term compensation by the body to protect itself that can turn into a very long-term issue, okay? So what we're trying to do with this is we're trying to stop that muscle from inhibiting or not working as well, and we're trying to build that muscle back up so that it can do its job better, so that eventually, and hopefully sooner than later, we can get rid of pain. What happens in a lot of cases is you have pain, the muscles become inhibited, they don't do their job as well, and then because they're not doing their job as well, we continue to have pain, and it's a negative cycle, okay? So we have to be smart about this, but the big goal with this exercise and this movement that we're going to go over today is to build a more resilient, less protective, more efficiently functioning lower back muscle, and basically a lower back spinal brace for you. And the other good thing about it is it's going to work other key muscles on our back side, our buttock and our hamstrings. And so when we do a lot of activities that we have to get forward, right, it should be a total body move. It's not just the low back doing the work. It should be some hips, it should be some hamstrings, it should be basically our entire posterior chain helping out and doing some work. And so that's what's a great aspect of this exercise. Hey, what's going on, Deb? What's going on, Jake? Thanks for joining tonight. What I want to do, and by the way, I did say before, make sure if you're watching live, you type into the comments live. If you catch and replay, make sure you pop into the comments there as well. We'd love to see who's all present with us. So anyways, the goal of this is to build a more resilient back and then also help build a better functioning, what we call accessory muscles, or muscles that are going to help the overall movement pattern, which in theory will take stress off the back. So let's get to it. Without further ado, we're going to try to give you something that's going to reduce inhibition of the muscles in the lower back if you have pain, help those muscles do their job a little bit better, build up some confidence in the low back, and build up some confidence in how to move to where the low back is not feeling like it's guarded or fearful or can't do what you want it to do, okay? So without further ado, we are going to teach the hip hinge pattern, okay? In a lot of mainstream, overall, we're going to consider this the deadlift pattern, but for the sake of today and kind of early introductory here, we're going to talk about the hip hinge pattern, okay? And that's a key word. So if you watch to the end, you want to join the challenge, that is a key word. So the hip hinge, all right, first thing we're going to do is we're going to teach you how to do it and kind of describe what it means, and then I'm going to show you how to progress it. But you have to be able to master the first part of this before you move on to the progressions. Keep in mind, this is for information purposes only. If you do something at home and it doesn't go well, please stop. Please come in and see me. Please seek the help of a medical practitioner. This is not meant to supplement or take the place of actual medical advice, okay? But it is giving you a glimpse into what we're doing with a lot of our people, and it's working quite well. So here we go. The hip hinge or the deadlift. What we want to do, I'm going to get myself a little space here. So what we want to do is we want to effectively teach our body how to push our hips back and let our trunk come forward, okay? But keep a relatively, what we call neutral spine or an original spine position, so that we're loading here, we're loading our hamstrings, and we are loading our low back, but we're loading it properly or efficiently, okay? And so the best way for, hey, what's going on, Mom? How you doing? The best thing for us to do to start introducing this pattern is to get a dowel or a golf club or something like that, okay? And what you're going to do is you're going to set this dowel up across the spine. So you're going to run it the length of the spine. I'm having a hard time seeing the dowel because there are so many people watching here. I'm going to have the dowel run the back of the head, mid-back, and then tailbone. So I have my hands kind of holding the dowel against these three spots, all right? So it's making contact in my head, my mid-back, and my tailbone. And what I'm going to do here is I'm basically trying to push my hips back, like I'm trying to push my hips back into a wall or into a chair. I'm going to push my hips back as far as I can without any of those three contact points leaving or without the dowel coming off of those contact points. So if I slouch too much, it's going to come off of my tailbone and I'm going to be kind of doing this sort of a thing. If I arch my back too much, it's going to come off of my mid-back here. And if my head gets out of position, it's going to come off of my head, all right? So that's what's going to happen at the hips and the trunk. You want the hips to go back, and you want that trunk to stay relatively neutral, all right? So meaning I'm not here, I'm not slouching, I'm not overarching. I'm just keeping the original spine angles that I have, which we all have different spine curves, so you basically can line that dowel up to your spine curve and then just try to maintain that spine curve as you hinge, right? Push the hips back. This is not a squat, so some people, they'll get here and they'll want to do this sort of a thing. I'm just going to get my camera lined up a little bit better for you guys. They want to do this sort of a thing, right? I don't want the hips going down, I want the hips going back. And what that's going to end up doing is really putting a lot of tension in work and effort through the backside and through the hamstrings, which is exactly what we want. Now, if you're doing it properly, oh boy. If you're doing it properly, I'm going to show my legs here, because if you're doing it properly, the other thing that should happen is the shins stay straight up and down, right? My knees are not doing this. My shins are staying straight up and down, okay? So the knees are bending, but the actual lower leg, or the shin bones, are not moving at all. They're staying straight up and down. Okay, so first of all, you master that pattern, all right? Really, the dowel and the cue of pushing the hips back, not letting any of those 3 contact points move, going as far into that as you can, pushing the hips as far back as you can, and keeping your shins straight up and down should get you where you want to go with that pattern, with that hip hinge. Now, why is this important? Because we need to be able to pick things up from the ground, from a step, from a stool, from a shelf. And if we master this pattern, it makes our body and our movement a lot more efficient for doing that properly. And we can load the right areas, and we can also have a much more resilient back, okay? I don't like to say that a lot of us that have back issues necessarily have weak backs, because I don't think that's always accurate. But I do know if you have pain, it is much more likely for your lower back to become weak over time, and then again, it goes to that negative cycle. So this is a great drill to master to strengthen the lower back, strengthen the helping muscles of the glutes and the hamstrings, and things that are going to help you get into this forward bent position without really compromising anything in the spine. Now, I'm all for folding the spine and doing some of this stuff, and you're not gonna hear me say don't flex the spine, don't fold forward. But when we're talking about picking up things and actually taking on some weight and some challenge, this is one of the more efficient ways to do it. So that's the starting point, okay? Now, if we want to progress this, let's say you do 8 of those, 10 of those, 12 of those, you know, you're gonna feel it in the buttock and the hamstrings, hopefully, maybe a little bit in the low back, and you've gotten to the point where you can knock this out and do 8, 10, 12 of these, nobody's business, right? Then we're gonna progress it. So the 2 progressions, I'll show you these really quick. I don't recommend these unless you have some instruction or you've really mastered the thing that we just did. So the first thing we're gonna do is we're gonna add a little bit of resistance or weight to it, okay? So now what we're thinking about, sorry, just adjusting again. Now what we're thinking about is getting the dowel no longer on the back, and we're gonna bring it here, okay? And we're gonna think about now what happens if I have to actually keep my hands low to pick something up, all right, and keep a neutral spine there. So you do a couple of these where you're doing the exact same pattern, but you just have that dowel or that golf club or whatever it is sliding up and down the thighs and below the knees. Once we master that, we say, okay, I'm gonna pick up some weight. I'm gonna elevate the step, I'm gonna elevate the weight, I'm gonna get it up a little bit higher so I'm not pulling all the way from the ground. I'm gonna keep the weight relatively light to start. Maybe you have a dumbbell, a lighter dumbbell you can stick on its edge. Maybe you have a lighter kettlebell you can work on. Really, you can do this with anything that has any weight to it and get it up off the ground a little bit. And now we're gonna say, okay, I'm gonna bring the feet on each side of the weight. I'm gonna get over top of it. I'm gonna use the exact same pattern. I'm gonna kind of pin my armpits to my body, and I'm just standing up with the weight now. And then reversing slowly back down. Okay? Now that's the challenge where if you really struggle with that, or if you actually have back pain, I wouldn't recommend doing that unless you're having some instruction, somebody observing you, watching you. So that would be one progression, and that's really great because now we're starting to add a little bit extra load, a little bit extra tension and challenge to the back, the butt, and the hamstrings. It seems scary. You're going to hear some doctors and some friends and family tell you that you shouldn't be lifting like this. You shouldn't be picking up weight from the ground because it's bad for your back. I call hogwash. I call baloney. You turn and you tell them it's only bad for your back if you do it improperly. If you do it properly, it can be one of the best things ever for your low back. And I will stick to that until I see research changing or anything else, all right? So deadlifting in the hip hinge is phenomenal when done properly. Now, the other progression that I like from that, if you can do 2 legs, if you master the pattern, master bringing the bar down the thighs, right? Master a little bit of light weight, then you can go to what I love to do, especially with a lot of our athletes and just people that need a little bit higher level challenge, is a single leg deadlift. So you come back, you use the dowel, all right, and we go more to, I got to get this camera figured out. Hopefully by day 3 of the challenge, I'll have it down pat. But what we're going to do here, keep that dowel back in that same position now. And now what you're going to do is you're going to actually go onto one leg. Ooh boy, it's been a long day, bear with me. All right, and you're thinking about kicking the hips back still, but as you do that, you're actually letting one leg come back up behind you as that trunk leans forward, okay? So this is more of a single leg variation that I really like for people. And again, probably when we get to that point, if you are having pain, you're going to want somebody instructing you and observing you and doing that properly. But if you're not having pain and you want to try some of this stuff out, just see what it feels like, certainly try it. And if you have any questions or you just absolutely feel like you have no idea what you're doing, shoot some questions in the comments, and we're happy to get back to you and maybe go over a little bit more in depth. So day 1 of the challenge is really about educating people on the importance of the hip hinge pattern, how unbelievably good it can be for individuals with low back pain. We do these techniques with individuals with active back pain, and I kid you not, sometimes these type of things work better than any sort of needle I could stick in somebody, any sort of cup or hands-on or manipulation or adjustment or anything like that. These techniques will help people feel way more confident. They'll help that tissue become more resilient, and they'll help people learn kind of how to move without fear and without guarding and without avoiding certain things that they've wanted to get back to doing. Now, don't get me wrong, I still use some of these other strategies to try to build people up to this point, but I will promise you this, that since we've been using this the last couple of years for individuals with back pain, we've kind of gone the opposite way of people thinking, well, you shouldn't be doing this if you have back pain. It's been a game changer for us and for a lot of our individuals that we work with. So that is day 1. That is something that I ask you to try. At a bare minimum, grab a longer object and try that first goal, try that first step. All right, head, mid-back, tailbone. The shins or the lower leg stays straight up and down, and you think about pushing those hips straight back. Do not let any of those 3 contact points leave, okay? So if you are watching live or you're watching on replay and you stuck around to the end here, the day 1 engagement or the day 1 participation, pop into the comments hinge, H-I-N-G-E, pop into the comments hinge, and I will count you as a participant for day 1. Also, outside of popping in hinge into the comments, let me know what you think about some of this stuff, all right? We have probably a varying amount of people watching this video because back pain, unfortunately, spans a lot of demographics and a lot of, I would say activity levels and body types and everything. I mean, you know, you get a lot of active people that struggle with back pain and they're doing everything the right way, and you get some people that aren't as active and they struggle with back pain. So it's going to be something that maybe you've done some in the past, maybe you haven't, but I promise, regardless of if you're a D1 college athlete or if you are, you know, somebody who is just looking to be able to walk 3 miles again and you have back pain, you're probably going to be getting something like this from us here at ModusRx Physical Therapy. And the goal is just to, again, build more resilience in your back, your butt, your hamstrings, and give you the confidence to do some of these things again, okay? And that's what it's all about. So, again, if you are live or replay, type in hinge in the comments. That'll get you participation for day 1. Day 2 tomorrow. I apologize, I came on a little bit late tonight. Hopefully that helped a little bit, get a little bit more engagement, but today got kind of crazy. So tomorrow, be on the lookout for day 2. We're going to go over our secret weapon number 2, and it'll be a very similar process as long as you watch live or on replay. Get the instructions at the end of the video on what to pop into the comments. I will count you as a participant for day 2 as well. All right, and then day 3 on Thursday. Winner will be announced Friday. Everybody wins because we're learning, and you're going to get some sort of participation trophy, as much as I don't like those. But I appreciate you hanging out and giving us the chance to talk to you a little bit tonight. Once again, I am Eric here at ModusRx Physical Therapy, and hope everybody has a great night. Make sure you leave some comments if you have any questions, or if you love it or don't like it so much. All right? Happy to talk. Thanks.